Your Excellency, Ambassador Tum, Honorable Ministers, Excellencies, distinguished guests and friends, I'm honored to join you today, John, with the group, and I thank Coalition of Hepatitis Elimination and African member states convening this important gathering today. I bring with me the voices of millions of Africans living with hepatitis who cannot be here with us today. Their hopes depend on how well, as leaders and partners, raise this challenge. Let me begin by telling you a story. I still remember the phone call from a friend of mine, very close friend, an orthopedic surgeon back home. Vibrant, full of life, has just been diagnosed with hepatitis B. He didn't know how, didn't know where to start and what it meant. What struck me most was just not the diagnosis, it was the silence around it. No one talked about it. No one knew the risks, and yet millions across Africa live with it every day, often undiagnosed, untreated, and unheard. That moment stayed with me, and I remember that behind every statistic, there's a story behind it. Behind every policy gap is a person, and behind every missed opportunity is a life could be saved. My friend died. The WHO Region Office for Africa has placed hepatitis high on its agenda. Our mission is very, very clear: to ensure that every country in our region has the technical tools, strategic guidance, and partnership needed to meet the 2030 elimination goals. 90% fewer new infections, 65% fewer deaths compared to 2015. We do this in 5 main ways: leadership and coordination, keeping hepatitis on the political agenda, policy translation, supporting the member states to adopt global recommendations into national plans. We do this through health system support, building surveillance laboratories, and supply chain capacity, making access to tools, advocating for affordable diagnostics and medicine, knowledge and partnership, convening the hepatitis community of practice to share the lessons. So what this support looks like actually, this support is visible across our region. 37 countries now have hepatitis strategic plans supported by Afro Guidance. 13 countries have integrated hepatitis service into their primary health care, often alongside the HIV programs. 35 countries test pregnant women for hepatitis B, and 30 have birth dose vaccination policies. This lays the foundation for elimination of mother-to-child transmission. Countries are achieving a remarkable milestone. I'll cite an example of Namibia, became the first high-burden country to achieve certification progress in eliminating vertical transmission of hepatitis B, with nearly 80% of infants receiving the birth dose. Uganda, the Honorable Minister is here, became the first African country to surpass the 2020 target of hepatitis B diagnosis. Honorable Minister, congratulations. Rwanda is on track to eliminate hepatitis C by 2024 through integration with HIV services. These successes are not accidental, my friends. They reflect the power of strategic guidance, technical assistance, and sustained partnership. But with all this, we have challenges. But we must be candid. Despite the steps forward, Africa remains far from elimination finish line. Every year, our region records about over 700,000 new hepatitis B infections and over 170 new hepatitis C infections. More than 65 million Africans live with hepatitis B, 8 million with hepatitis C, and over 300,000 die from the disease each year. And the sad part, at a very tender age. Testing and treatment rates remain critically low, medicines unreachable, and services centered in urban hospitals only. Financing, despite the financial uncertainties, it was fragile, with heavy reliance of out-of-pocket payments, which I usually call is recycling poverty. So what do we need to do? To accelerate progress, we are focusing on 3 priorities. Scaling up diagnosis and treatment by embedding hepatitis services into primary health care, HIV and maternal health system. Securing affordable tools through pooled procurement, negotiating pricing and faster registration of medicines, which sometimes can be very bureaucratic in our continent. This also means reducing price variation across countries to ensure equitable access. And we are on that way by the local manufacturing, which is on discussion at the moment. Building a more resilient data systems so countries can track progress and be accountable, because without having data, how would we know the impact of hepatitis? We are strengthening our surveillance, and strategic information is essential to guide investment and ensure equity, but we cannot deliver this alone. We need greater domestic financing. Alongside innovative partnership with donors, when we say of domestic financing, doesn't mean we are going to stop discussing bilateral meetings with donors. In conclusion, Excellencies, dear friends, the WHO Regional Office for Africa is fully committed to supporting our 47 member states. With the right technical and strategic support, countries can achieve extraordinary results, but time is short. To meet the 2030 targets, which is just less than 5 years from today, we must match technical progress with political resolve and financial investment. If we act together, Africa's hepatitis story will not be one of the preventable suffering, but rather of solidarity, innovation, and triumph. The millions living with hepatitis across our continent deserve nothing less. I thank you.
Thank you.